CCOFS is very fortunate because of the fact that we do a lot of this, we have high volume, we're fortunate to be on the leading edge of much of the technology.
We're one of the largest groups in the nation that does outpatient and also hospital-based jaw surgery. So during that time, you become really accustomed to orthognathic cases, not only the actual execution of the surgery itself, but the treatment planning.
Through attending continuing medical education focused on corrective jaw surgery, attending our own practice craniofacial deformities conference, and then collegial conversations about cases. It's the best part about being a part of a group at Carolina Center for Oral Facial Surgery.
Certainly, anytime someone is facing surgery, they're going to have butterflies in their stomach. They're going to have anxiety. That's called being human. What we attempt to do is spend a great deal of time with patients and their family, their support system, prior to any surgical procedure, making sure they understand the procedure at great length, the flow of the day through the facility, as well as very detailed post-operative instructions, diet, medicine, ice, heat, prescriptions, rubber bands, etc. How we keep those complication rates low is the methodical, repetitive, we do it the same every time.
We do 300 to 400 of these procedures every year. We do them in an outpatient setting. So we have extreme comfort and familiarity, not only with the procedure, preoperative care, but also the postoperative care.
Ways we mitigate those potential risks is we virtually plan all of our surgeries. So we can do a deep dive into the 3D anatomy of the patient, know where the nerves are within the bones. Even though we can't see them with our eyes, we know where they are because we've done the surgery on the computer. And then we can tailor our design of our cuts or our bony cuts or osteotomies accordingly to help protect.
All these things put together has decreased the time that usually a 6-hour surgery became complete in 1.5 hours. When you're under anesthesia for a shorter amount of time, you're doing surgery for a shorter amount of time, you're going to have less risks.
I think it's normal to be stressed or anxious leading up to a major surgical intervention like orthognathic surgery. What I tell my patients and their loved ones is, the good news is we're not stressed, we're not anxious, because this is something we do every day. It's a big part of my day-to-day practice, and it's a big part of how we take care of our patients.
In regards to ensuring patient safety, for those cases that are done within a hospital, we as a surgical team are going to use a facility where we have been before. In the Charlotte region, we generally use Atrium University Hospital. The benefit of that hospital is we as a practice have been going there for 35 years. They all know our patients because of the fact that we've been going there for decades. Our offices are accredited by AAA-HC, which holds us to standards regarding patient care, safety, and so forth. But in our offices, when surgery is delivered, we again have confident and trusted anesthesia teams that we've worked with for years, for decades, but also the benefit of bringing our surgical team to, whether it's the hospital or whether it's obviously our office. It is a lead surgeon, it is a trusted assistant surgeon, and it is surgical techs who are very comfortable passing us instruments.
We have great familiarity with orthognathic surgery, with moving jaws, with tooth position, with occlusion, and all of these things I think really separate us to allow us to have great comfort in orthognathic surgery and provide you the best care.
Every patient has their own face, their own bite, their own problems. You know, when they come to my office and they tell me, you know, I have issues biting on my back teeth, or I have TMJ issues, or I can't breathe that night, I snore. All of those things, those components get factored in. And then now what we can do is we can plan our surgeries. I can go to the patient before we ever go to surgery and I can show them, okay, this is what I want to do for you. This is how I think I can help you. Here's the advantages and disadvantages of this particular technique. What do you think?
Virtual surgical planning really allows us to tailor what each individual's needs are, case by case. Post-surgically, one of the most fascinating factors is the immediate transformation that orthognathic surgery provides. You know, when you have an occlusal discrepancy or facial difference where your bite does not match exactly where it is, and then immediately post-surgically the bite is socked in to where you have a normal class 1 occlusion. Those instant results are not only gratifying for us as surgeons, but also for the patients and their family.
The beauty of jaw surgery is, one, you spend so much time planning out a surgery for your patient. You spend so much time talking to them, getting them ready for the operating room table. And then being the first ones to actually see the change in position, be part of that journey is just very beautiful.
I believe we have a lot of individuals who have success stories after having jaw surgery where we've been able to truly change their life. This may stem from an individual who has maybe shy or may has been bullied because of the fact of the way they look. They have a strong jaw. They don't have a chin. There's nothing better than making transformative changes to where they now have a great bite, but also have facial balance and proportion. And we find that oftentimes brings people out of their shell.
When I think about patient success stories, there's one in particular that comes to mind. A man who suffered from severe obstructive sleep apnea. He would often fall asleep while driving his car at a stop sign. He'd fall asleep at a red light. He'd often fall asleep at work. And he really struggled with his severe obstructive sleep apnea. We performed corrective jaw surgery or orthognathic surgery to both improve his bite and improve his airway for breathing during sleep. And I remember he was in tears. He was crying. I said, "Oh my God, what happened?" And he said, "I just drove to Florida." And he was so elated that he was able to do something that myself and lots of people I know take for granted. It was merely a drive to Florida, and he was just so happy. And that was a day I'll never forget. I think one of the most rewarding things about orthognathic surgery or corrective jaw surgery is being on the journey with the patients and their families.
I get up in the morning, I'm excited about the cases that I have planned, about the patients I'm going to see, about the staff I'm going to interact with.
It's nice to have success stories where a patient had functional issues, sleep apnea issues, cosmetic issues have completely changed.
We get that immediate gratification that the patient ultimately gets to see when they, complete the surgery and, post-operatively begin to see those results as they look in the mirror.
After going on a journey with a patient through their surgical plan, through the surgery itself, and through their follow-ups, you see them change, you see them grow, you see them become more confident after one, either it was an aesthetic concern or even if it was a functional concern. You see that your patients are starting to live the lives that they were always meant to have, but either genetics or trauma or other environmental factors kind of kept them from having that life. Being able to give that back to the patient is just probably some of the most rewarding things that you can ask for.